that's better. Hi, folks. Diana here with Adventures in the Making. This is my second video. I'm getting it figured out. I'm sitting in a Walmart parking lot because I just bought this camera mount thing for the front of the dash, and I'm just seeing how it'll work. Anyway, I'm just here to let you know that today is the first anniversary of my breast cancer surgery. I had a little teeny tiny spot that they couldn't believe they found it, and I could tell you all the names they call it and all that, but it's not. It's it's gone. Um, the surgery went really well. Uh, there's a lot to learn about cancer. Wow. Um, I had a 6 month checkup with a high powered mammogram. It's clean. I have a surgeon appointment for the 1 year checkup the last day in April, I believe, and not a problem. We'll just go in, and I don't know what she'll do. That's the whole thing. There's every cancer's different, every patient's different. You just don't know. It's all. And if you've never done it before, you have no idea what they're going to do, what they're going to expect of you, what they're going to poke and prod and take another mammogram. I don't know. So, well, we'll find out in April. Um, it's been a rough year. I will admit that. Um, Scary? No. More. What now? What's next? I was never fearful. I never had. Oh, I'm gonna die. That's ridiculous. We're all gonna die. So I didn't really care. Um, it's gonna hurt. I don't like pain. Uh, yeah, hurting. Yeah, that was probably even today, uh, the breast tissue, uh, it never goes back. I mean, I had this little teeny tiny cancer, and they took out like tuna fish can size of tissue, and it never goes back. I mean, you don't fill out. It doesn't. It, the the lymph nodes, they took lymph nodes out, and the lymph nodes go, oh, we needed those three fellas. And sometimes I get sharp, stabby pain. Sometimes it just throbs, and it's like, come on, guys. This is crazy. Some, the radiation it wasn't awful, but towards the end, it was just like, I want this to end. And it finally did, thank God. Um, but I did get a pretty good sunburn. That's par for the course, I guess. And they gave me some really good sunburn meds. Um, so you walk around without a bra on and your shirt pulled out because any anything on your breast hurts. So, but that's all done. That took a couple months to heal. Um, I had to go in because the breast tissue gets hard because it gets filled up with lymphonic fluid that needs to be redirected into different areas. Um, so you learn to massage things and get lymph nodes working and other lymphatic systems reabsorbing. They They had a $500 bra that was ugly, 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 ugly. If I'm gonna buy a $500 bra, it had better fit me perfect and it had better be absolutely gorgeous. This bra was so ugly. It was just ugly. I said no. I'm not even wearing that. We'll figure something else out. I mean, and I'm not that way, but that was way ugly. Just and we measured it wrong, and I just said for 500 bucks, nah. So so now I just wear sports bras that are one size too small, and that compresses whatever needs to compress for the fluids, and that's basically all that bra was supposed to do is be a compression chamber, you know. So other than that, outside of just the learning of cancer, the things that happen, the things that people, mine was unbelievably simple compared to some other people's. Um, I didn't have to have chemo, but it was offered if I'd had to have it, and I wouldn't have taken it anyway. I, I, no. And then they offered me a drug after the surgery that would have either prevented this cancer, that whatever it was, to come back, or it may cause this cancer to come back, or it may cause other cancers to develop. Well, to take a pill for $500 a month for those options, I said, no. If this cancer decides to come back, it'll come back on its own. I'm not going to help it. And I'm not going to take a drug where they know that it could cause other cancers to develop. Why would I? Why would anybody take that? Why? It makes no sense. But that's okay. I chose not to take it. So, yeah. So, that is just, sometimes you wonder. Um, I was never afraid. Uh, I don't like pain at all. So, there is pain involved. Not bad, but I'm not wanting any. But you had to do it. It was more of a, I don't know. But my mom had cancer. So, cancer for her was deadly. They gave her a 5% chance of living. But her cancer, they called it blood cancer or bone. But anyway, it's wherever the cancer is developed in the body that they find is what it's called. So it's not like it they know where it started. They just found it in her bones. And so she goes, well, you have bone cancer, you know. But it could have started in her lungs. The woman smoked like a chimney and drank like a fish. It could have been anywhere. But it eventually it went into her brain and her blood, and it just, the doctors, hold on a second. Uh, the doctors had given her 18 months to live, and she lasted 6. She did do treatments, and she did do chemo, and she just decided no, she was ready to go. It wasn't any. It's like, why should I be really sick all the time I'm living just before I die? So, and I don't know. She lived in Arkansas, and we didn't see her, so I don't really know, you know, what she went through. She had friends, she was with people, and social services helped, and she had family and friends, so that worked out. But, you know, she had called and said, no more of this, I'm ready to go. And I was like, okay, you know. Um, she was a nurse and she didn't want to look like a concentration camp survivor when she died, where they're just skin and bones and kind of a. She wanted to look. She said she looked. She was the weight she was when she first got married, and she thought she looked pretty good, and she was quite happy to check out looking good and feeling good. So that's what she did, and you respect that. She had also um, accepted Christ just before she died. So that's a good thing. And and she it's kind of funny. She got her fire insurance. She didn't gather any of the benefits of being a born again Christian, except when you die, the belief is you go to heaven. Um, but but yeah, that's fine as long as she's not sitting in hell. That you gotta say something about that. That's a good thing. So, and that's our belief. That's my belief. That's why every time I go under surgery, um, I said, unless you can bring me back whole and healthy and not a vegetable, I'm going to heaven, so I'm okay. And people laugh, but you know, uh, yeah. If you can't, if I, well, anyway, that's another thing. But anyway, I'm just letting you all know that life is good. I never had any cancer symptoms, so I couldn't tell you if it's chosen to reemerge its ugly head. I doubt very much it has. However, I do recommend that if you are told you have some kind of cancer, um, start taking vitamin C. Because if you're going to have radiation, radiation will kill your immune system just something fierce. It takes everything out of you. I mean, chemo's even worse, but radiation really drains your immune system. So get as much vitamin C into your system, keep it up while you're going through treatment, and just excuse me. I've been sick for a week and a half. First day out. Um, but that's the main thing. And don't be afraid. There's a lot to learn. There's a lot to go through, but most cancers nowadays are treatable or fixable, and and if it's not, well, get your affairs in order because we're all gonna die. And how we choose to die is our option in life. If we're in a situation where you know we have the choice. So, well, this is Diana with Adventures in the Making, and we'll talk to you later. All right, bye bye. Click. Bye. Are you sure you want to stop streaming?